what other of these supplements have you seen work for something like ADHD?
Sure. I mean, there's a lot. And again, the personalized approach is the most helpful. I start the book off with magnesium because I think that is the one supplement that I've found over 90% on testing our kids with ADHD and our adults are deficient in. So magnesium being number one, and zinc, because there's a very common high copper in our kids with ADHD. The mineral lithium, we use low dose lithium, 1 milligram, 2 milligram, and this is particularly good for irritable or impulsive kids or adults. Some of the road rage, some of the individuals that kind of can't stop themselves from getting into fights, either verbal or physical. The one kind of nutraceutical, it's not a vitamin or mineral that we've been using for many years, is called OPCs, oligoproanthionidins, is the big term. It's the colors in grapes and blueberries and chocolate and green tea. So it's these flavanols that we've shown in some research early on in the 90s, and lots of research that's been written about, can really help improve attention. So grapeseed extract, pine bark, blueberries are all kind of forms of this flavanol phytochemical called OPCs.
Oh, wow. Those things you named off, I know those, but I've never heard them referred to as OPCs. That's very interesting.
Yeah, these were discovered years ago. They kind of work with vitamin C, and they kind of strengthen, they do hundreds of things in the body. They're powerful antioxidants. And as individual nutrients, they've gotten a little research, the green tea and the pine bark and the blueberries, and we've just found combinations of those OPCs to have the most dramatic effect on sustained attention and ADHD symptoms.
And you had mentioned lithium. Are you referring to lithium as in prescription lithium, or is that like lithium orotate that's over the counter?
Yeah, for most of the ADHD individuals, we're talking about lithium orotate, low dosages, 1 or 2 milligrams, sometimes titrating up to 5 milligrams. And this most helpful for, again, these irritable, angry, impulsive kids. We've had the kids that are kicked out of preschool, kicked out of private schools, just because they can't control their behavior. When you meet with them, they're remorseful, and they are quite articulate about not having the ability to stop some of these behaviors. And on low dose lithium, oftentimes it's pretty dramatic. Within a couple of weeks, they're feeling better.